So renal medullary carcinoma tends to, affect or be diagnosed in patients with African descent. In where I practice in Louisiana, in New Orleans, right? We do serve we have an underserved patient population for which it's a higher probability of us finding patients with renal medullary cancer, right? When we see them in clinic, I think we are more or less aware of some potential barriers and challenges, right? So in my own experience, cultural changes are relevant. So a lot of times I find I need to use different approaches to bring up a clinical trial to those patients and to get their input and understand, why that can be potentially helpful for them, right? Another aspect that comes, side by side with that is, there are different social economical differences. So unfortunately, not all these patients actually have access to care the way we assume they do. And so access to care is a real problem that we're working hard, but we need to do even a better job of minimizing that. And that's an important barrier, right? Because if you don't get access to care, you don't get diagnosed early, and that can have potential, implications in your prognosis, right? So that would be another challenge that I've encountered in my normal clinics that I run in New Orleans.